Tonight, we're going inside one community with some of the strictest closures and curfews in the entire country, and here's why. The Navajo Nation has one of the highest rates of infection in the U.S., and sadly, with few resources and little infrastructure, it's one of the least equipped to handle a health crisis like the one we're in right now. Our Matt Gutman reports on the unique challenges the Navajo and many indigenous people now face.
Dr. Sri Shamasunder has been practicing emergency medicine from the back of a car.
How's your breathing?
That's good.
But there are limits to what this team can do.
So EMS has just showed up because the gentleman is telling the folks here at COPE and Dr. Sri that he's got shortness of breath, asthma, and they're trying to decide whether or not he needs to be hospitalized at this point. Everybody here is under investigation for COVID.
And COVID-19 is surging through the Navajo community, suffering one of the highest infection rates per capita in the country. The peak weeks away. Dr. Sriram is the co-founder of the HEAL initiative at the University of San Francisco.
I think with the Native population, it is similar to what we've seen vulnerable patients all over the country in terms of whether it's Black or Latinx population in the Bay Area. They are more susceptible, and in New Mexico, the Native Americans only make up 5% of the population, but they make up 20% of the COVID population.
He's teaming up with locals like the COPE program's Nitumagabo Champagne. They're doing rounds at this motel in Gallup, New Mexico, where the unsheltered and the sick can go to get off the street and away from extended families.
So mostly the headaches bothering you?
Yeah.
No, any blurry vision?
No.
Eric Joe, who's a grandfather, talking with us through that broken mask.
Yes, I was worried about my family, but like I told you, I called. They're doing okay.
Okay.
The virus has claimed dozens of Navajo elders and even some of its young. Former Miss Western Navajo, Valentine Blackhorse, was a mother of a 1-year-old daughter. She died this week after testing positive for COVID-19. She was 28 years old. Navajo President Jonathan Nez says his tribe has to rely primarily on itself. It's one reason he's instituted one of the strictest shelter-at-home orders in the country, and during the weekend, curfew.
Flatten that curve, lessen the virus here, and really stop the virus. And the creative way we're doing this is by putting a shelter-in-place order, and we're also putting the curfews Monday through Friday, 8 p.m. to 5 a.m. Weekends, 57-hour curfew.
Historically, the U.S. government hasn't helped much, breaking dozens of promises with Native American tribes. And Congress has approved $8 billion for tribal assistance, but that money has to be split amongst 574 tribes.
Sometimes it goes through the federal agencies before it gets to the tribe, or it goes through the state before it gets to the tribe. We're using that same process, and we have to wait, and we have to submit for these fundings. But the need is now.
It's estimated that about 30% of the people who live on the Navajo reservation do not have access to running water, which is why they use pumps like this. And that makes the constant hand washing necessary during a COVID outbreak that much more difficult.
At that pump, we met with Elmer, who was there to get water.
During the time of COVID, everybody's worried. You got to wash your hands, clean all the time. When you don't have running water, does it make it that much harder?
Yes, it does. And for little children to wash up daily, to have them clean daily is a problem. And they love to play outdoors.
Since early March, grassroots groups have worked to provide food and water. The Navajo and Hopi family COVID-19 relief effort raising over $1 million. Setting up this makeshift hand-washing station and distributing it around the reservation.
It's just one fix to address the hygiene issue. Don't wait until people are sick, because the conditions that are making people more sick and more at risk are right out on the street.
Navajo Nation is larger than West Virginia, but its population of about 300,000 has access to only about 20 ICU beds on the reservation. The Indian Health Service says they've had to build additional temporary hospital beds to prepare for a modeling prediction of over 200 additional patients a day and over 100 ICU-level patients across the area. In the vastness of the reservation under the shadow of Chimney Butte is where Michelle Tom grew up.
Actually, you can see where I'm from. It's called Chajani Aha.
Also without running water or power. She's now the only Navajo emergency physician at this urgent care clinic in Winslow, Arizona.
You're getting people pulling up to this parking lot. They had to be intubated here, even though this is not technically an ICU or a hospital, it's an urgent care.
Yes.
And then the only way to save their lives is to get a helicopter here.
Yes.
And then what?
We don't know. We don't have access to them anymore, and that's where the disconnect, and that's where the hard part it is for us. Especially for me, if I know, everyone knows everyone, and I think I hear it more so because I have relatives, and we all know who's not doing so well. And as soon as they leave that chopper, they're no longer in our hands.
She says the closest ICU facility where she can send her patients is at least 1 hour away by chopper or up to 3 hours in an ambulance.
I said I was going to come home after all my medical training and so forth. I essentially am home.
So you wanted to come back here,
yeah.
And Winslow's home, and that's why you feel it's important to be here.
Yes.
Of course, it's no longer a hospital. And growing up, Tom says she never saw a medical professional with a face like her own.
How does that make people feel that they don't get medical consultation, they don't see people like them as their medical providers?
Well, I can only talk from personal experience, right? Sometimes there's a disconnect when language and cultures are not meeting. We know that just by studies and even by experience, you're not going to have the best health care.
That's not from a lack of effort.
I was doing car triage yesterday, and I would say we had about 15 cars. You know, and
that's car triage. You're just going up to the window
by itself. Just me on my shift in the car triage.
Wow.
And that's not counting Little Colorado Medical Center, who is an ER. That's not counting ones that bypass me to go urgent care. Huh. So these are presumptive cases. So.
And the other issue is that, this is a matriarchal society, and people live in a community, and sometimes it's 6, 7, 10 people living in a house or a household, and people are catching it quickly.
Yeah.
Is that the case?
So that pretty much, along with like the healthcare access, right? We also have that multi-generation. We do.
Yeah.
And that's part of our origin studies. That's how we are as a people, that our community comes first. Our people come first. These are our neighbors. These are our relatives. These are our brothers and sisters. So when we're telling them to go home and isolate, they're isolating with a people. And that's even for myself.
She left her family and moved to an apartment an hour away to try to minimize the risk of infecting the group of people she's trying to save.
My job is immensely hard because I have such a connection to my people and to my land. Our elders, our teachers, our protectors, they hold all of the key elements that we need to have a strong sense of identity.
Great insight there from Matt Gutman. Thanks for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.